You are today seeing a presentation for American Dental Management's group benefits offered for the 2017 to 2018 benefit period. Open enrollment is currently active. Emails have previously been distributed to all managers and coordinators with information that is pertinent to the open enrollment period, including the enrollment form handbook that goes into detail as to the benefits that are being offered, as well as a handbook identifying what is considered to be special enrollment. As an office manager, coordinator, or employee, it is your responsibility to, one, make sure that the employees you supervise are aware of the open enrollment period, to identify any questions they may have, and to ensure that all questions are answered. Furthermore, it is your responsibility as the manager or coordinator supervising employees to ensure that all forms are retrieved from employees and submitted by the deadline so that the employee can be properly enrolled without any delays. Open enrollment officially ends Tuesday, October 31st. In order to ensure that all forms are processed in a timely manner and the deadline is not missed, we are asking that all forms be submitted to benefits@admgllc.com no later than Friday, October 27th. Apex Benefit Group is our benefit administrator. They are here to help you with any questions you or any employee you supervise may have regarding benefits, enrollment, and special enrollment. There are currently 5 plan choices available to employees and dependents or spouses of employees. We will go into further detail on each plan available. MEC, which stands for Minimum Essential Coverage, provides minimum coverage. MEC Plus has some additional hospital benefits that can be added on to the MEC plan. The MEC Enhanced has more benefits than the MEC plan with some prescription coverage and can also have an add-on plan for hospital benefits through the MEC Enhanced Plus. The MVP plan is the most substantial plan being offered. The Minimum Essential Coverage plan for the employee is sponsored 100%. This means that if you, as an employee of the company, enrolls in this plan, there will be no out-of-pocket premium for you to pay. However, should you decide to add on a spouse, children, or your family, there will be additional costs to you. The breakdown of costs is based on your biweekly rate, seen as payroll is paid biweekly. Should you choose to enroll your spouse, child, children, or family, the amounts noted would be taken out every 2 weeks from your paycheck. What does this plan cover? This plan covers 19 adult preventive services, 23 preventative services for women, and 29 preventive services for children. The enrollment guide goes into detail as to exactly which preventive services are covered under this. This is a brief breakdown of what some of those preventive services are, including annual preventive visits, blood work, tobacco use counseling, screenings for blood pressure, cholesterol, depression, obesity, osteoporosis, hepatitis B, and cancer. The MEC Plus is an add-on to the previously discussed MEC plan. Again, for the employee, there is zero out-of-pocket cost for this plan. However, you must make sure to check off the MEC Plus on your enrollment form in order to be enrolled in this plan in addition to the regular MEC plan. Failure to do so will result in only being enrolled in the MEC plan. With the MEC Plus, these rates are contributions. So these are not representative of copays, as is typical to many standard plans that are out there, rather a contribution. Our benefit administrators explained it to me, and that you are issued a separate card for the hospital indemnity that resembles a credit card. And with this, if you have daily in hospital, surgical inpatient, surgical outpatient, they would swipe the card much like a credit card. And if there was any balance following that, then the employee or the benefit holder would be responsible for that. So, for example, if you have a surgical inpatient and the bill is $900, you would swipe the card and you would actually get a credit of $100 on that card that you could then use as like a credit card. However, if the surgical inpatient is $1,500, you would swipe the card, they would deduct the $1,000, and then you would have to pay the $500 difference. That is how all of the pricing works on this MEC plan. Again, these are not copays. These are just contributions toward those procedures, and there are also limitations. Emergency room visits, they'll pay $100 per visit, but only up to 4 visits. Daily in-hospital, they'll pay $300 per day, up to 31 days of confinement. And I believe if you look at the enrollment guide that the hospital confinement may be limited to once a year as well. The RX, again, not copays, those are contributions. So for generic, if the drug is $15, again, you would swipe the card. It should deduct the $15 from the card, and then you would have that $5 credit to use as you wish. MEC Enhanced. MEC Enhanced does bump this up to more of a copay type plan. As you can see, the employee contribution would be $20.73 biweekly. To add on the employee and spouse would be $105.54 biweekly, $71.61 to add children, or if you want to do the family, $156.42, again biweekly rates. With this plan, there is a maximum out-of-pocket expense of $2,500 for in-network providers. The $13,200 is for out-of-network, but as our benefit administrators told us, you can only go to in-network providers. So I'm not really sure why the $13,000 is there. Emergency room visits, you're limited to 2 visits per year, but the copay would be $400. That's a set copay. It's not going to be more than $400 or less than $400, as long as it's within the 2 visits per year minimum or maximum. Primary care physicians, $25 per visit. Again, they must be in network. Specialist, $50 copay. And preventive services, again, are covered 100%. Here, the prescription plan is actually a co-payment plan, so you would pay a set amount each time you had a prescription. So for those employees who may have more expensive prescriptions and the $20 contribution that's available on the MEC plan isn't going to really be helpful, then this may be a good plan to look into upgrading to. Now, unlike the regular MEC plan, the MEC Enhanced Plus is an additional cost on top of the regular MEC Enhanced. So the fees represented under the MEC Enhanced would be, the MEC Enhanced Plus would be added onto those fees. So for example, for the employee, the MEC Enhanced Plus is $26.51 biweekly. That would be added onto the $20.73 biweekly for the MEC Enhanced. So you're coming out at a little under $50 biweekly for just the employee. Same thing with the spouse and children and family. Those would be added on to the MEC Enhanced fees. Again, this is contributions, not copays, but this will give you some contribution toward hospital visits, surgical inpatient, outpatient, intensive care, and hospital confinement. The MVP is the most robust plan. It may at first glance not seem to be, with the deductible being $6,500, but when you think about it in the grand scheme of the medical world, I think the last time I looked, typically a pregnancy can end up costing anywhere from $10,000 to $15,000. So in the scheme of that, and that's something that's pretty affordable, as opposed to major surgeries, which can be in the 5 to 6 digits and sometimes even more than that. Um, Budgeting and setting aside enough money to cover that deductible can really be a benefit. This is full hospital coverage, so as in all of the other plans that we just looked at, there were only indemnity plans that would just contribute a certain amount if you had to be in the hospital or emergency room and different things like that. With this plan, once your deductible is reached, you don't have any co-insurance other than for primary care and specialist regular visits. Emergency room visit is covered 100%, inpatient hospital is covered 100%, diagnostic imaging is covered 100%, outpatient lab covered 100%, and preventive services. Primary care physician, $40 copay, then 50% coinsurance. So you have to pay the flat copay every time you visit the doctor, but then on top of that, there's always a bill for that visit. So if the bill for you go for a routine exam, sick, and you have to go in to see the doctor, if the visit would come out to $100, the insurance would be billed. They would cover 50% of the $100, and you would cover the other 50%. And of course, they're going off their contracted insurance rates. So if the fee is originally $200, their contracted rate, is going to be lower than whatever the cash fee would be. Same thing with the specialist. There is a maximum out-of-pocket expense of $6,500. So other than copays, once you hit your deductible, again, then you won't even have to worry about that coinsurance. As far as the cost of the MVP plan, right now we're contributing as the employer about $200 per employee who is a full-time employee having completed at least 90 consecutive days with the company, meaning 120 hours or more per month. So the government regulations do not allow for anyone to pay a premium that comes out to more than 9.69% of your salary per year. So when that says 9.69% of your salary, that's not saying that that's how much it's going to cost. That's just saying that it's not going to be more than that. To make it simple, so in the entire year, your premium rates could not cost you more than $96.90 if your annual salary was only $1,000. Now, obviously, I'm being very ridiculous with that because everyone is going to have an annual salary of more than that if they're eligible for benefits. But if using that same picture of $1,000 annual salary and paying $96.90 being the threshold, if the employer was contributing $1 a month, the benefit itself costs $96.90. With the employee contribution, it would actually be less than $96.90. It would be $86 or minus 12 if it's $1 a month. It would be $84.90. So hopefully that makes sense. The one thing with the MVP plan is you do need to call in. The number is also provided in the enrollment guide because there are a series of questions that have to be asked to ensure that you don't end up being charged more than the 9.69% of your annual salary. So in order for that to be determined and make sure that whatever your out-of-pocket cost is does not exceed the limit set by the government, you have to go through a questionnaire that will be done over the phone as part of your enrollment. Out of all of the plans, this definitely is, as I said previously, going to be the most comprehensive plan. If you have family members or for yourself, you know that you need a little bit more coverage, then this is going to be a good plan to go along with. Since once you reach your deductible, things are pretty much covered 100%. Here we get questions about the insurance. This is through Loomis again, which is the company that we used last year. They're the company that issues the insurance. So as far as healthcare services, this is a PPO network. The name of the network is First Health, and this website is where you can go to check and find out what providers are in the network and which providers will be able to see you. That website is www.firsthealth, lbp.com. You can also call and speak to a representative at 1-800-226-5116. Also, I mentioned that there's a guide for special enrollment periods in addition to the enrollment guide and the waiver form or the enrollment form. And that enrollment guide answers the questions about what if I want to change insurance or add someone on after the open enrollment period. And especially if someone is not sure about what plan they want to go with or considering whether or not they want to enroll or add on a spouse or family member, it's really important that they understand the special enrollment periods. There are certain life events that can happen where they can be eligible for a special enrollment. A few are listed here, such as you're currently insured, but you lose that health coverage after open enrollment. You have a baby after open enrollment, therefore you've gained a dependent and you want to add them on. That's considered a special enrollment. You move to a new address and that area no longer works with your current plan, or whatever the reason is, but that can be considered to be a special enrollment. Your income changes and perhaps what you were previously using is no longer an option. That can also be a reason for special enrollment, as well as a change of employment for you or a spouse. Again, the special enrollment guide that you all have access to goes into very specific and details. The key thing with special enrollment is unless you meet a qualifying special enrollment item, if you do not enroll or and you waive coverage during the open enrollment period, which is right now, you cannot make any changes following October 31st. So if you are eligible right now and you choose not to take the insurance, you cannot add on to the insurance following October 31st unless you meet one of these special enrollment periods. Same as thing goes for changing anything about the plan if you enroll. So say you enroll and you enroll in the MVP plan and 6 months into it, you don't feel that what you're paying into the plan is really benefiting you. You've been really healthy and you haven't had to go to the hospital or use the plan for anything other than preventive. And so you want to drop down to the 100% employer sponsored plan, the MEC plan. You won't be able to do that unless you meet one of the special enrollment period items. The flip side of that is you enroll in the 100% employer sponsored plan, the MEC plan, and 6 months out you had to be in the ER, you've had the flu, you've been sick, you've been in the hospital, and the medical bills are piling up, and you're wishing that you had enrolled in the MVP plan. And you call us up asking, can I upgrade my insurance? I'm dealing with all these medical bills, and I wish I would have enrolled in that plan. Again, unless you meet one of the special enrollment items, and such as losing your insurance through your spouse or getting married or something like that, you're not going to be eligible to change the plan. So just make sure you understand that moving forward. Again, I always recommend that if you're not sure and trying to decide if you want to waive the benefits or not, the MEC plan doesn't cost you anything. It's 100% employer sponsored. So at least enroll in that if you don't do anything else. Here's the information that we've gone over already. October 13th through the 27th is open enrollment. All changes must be submitted via the enrollment form. So if you are an employee who is already enrolled in a plan or has sent in a waiver already for the 2016 to 2017 period, if you want to keep what you have, be it no insurance through a waiver or the plan that you were previously enrolled in, you do not have to fill out an enrollment form. I am asking that for managers and coordinators, you still send us a list of every employee that you supervise and just let us know no change, waiver, or enrollment form attached so that we can quickly look to see that we have everything we need. But if people are already enrolled from last year and don't want to make any changes, they don't have to do anything. If they already filled out a waiver for 2016 to 2017, there's been no lapse in employment, then again, they don't have to do anything. Everyone else must fill out a form, either to enroll or to waive. For anyone filling out a waiver, please also send a copy of their insurance card along with the waiver form. Please send all enrollment forms no later than Friday, October 27th to benefits@admgllc.com. Also, if you have any questions, Ingrid and Rudy are great help. They came on Friday to present everything, and their telephone number is 215-795-0509. You can also email them at service@apexbenefitgroup.com.